DNS does back that up by saying the biomechanics or the visual inspection that we're using is based on the neurologic framework that was set up in development. And
Yes, so I think that really when we look at the whole aspect, we can see the obvious, and we can also detect the more subtle aspects of a poor movement, not ideal movement, not efficient movement, and what we can do about it then has to be based on our assessment findings, and then we can move on. This makes it much more important than just assuming that, again, that the person who is moving poorly may just need to be told to move better. There are reasons why he is not moving well, even if he understands what good movement should be.
Yeah.
Yeah.
I mean, so then, moving a bit on from that, it's like we're talking about using this developmental framework, of course, as DNS providers or DNS instructors. That is kind of our fundamental concept of movement. You inevitably get the question, so I'm an adult or I'm an athlete or I'm 65 and I'm supposed to roll around on the floor like a baby, or I'm supposed to breathe like a baby. How, again, just for the sake of it, how does moving or mimicking the patterns that a baby uses going to translate to the adult patient, the adult function, or even as simple as something as simple as like symptom relief? Why I have low back pain, I have neck pain. Why are you having me roll around on the floor? Why are you having me breathe? Why are you having me assume these baby positions?
It goes back again to deciding how you think of movement. If we see movement in development, it is built up sequentially from small building blocks of movement that become linked together into more complex sequences until they become synergies, and they eventually become activities of daily living. So the requirement is that when we see an activity of daily living that is failing, we must be able to break it up into its synergies. We must be able to break it up into the fundamental movements that constitute those synergies. And we must then assess these fundamental movements for their quality, their coordination, and their efficiency. So I have you roll around on the floor, not because I enjoy watching you take a look at the carpet pattern. I have you roll around on the floor so I can see what is your simplest strategy for turning. What is your simplest strategy for crawling or moving diagonal limbs in tandem and in coordination? These are basic requirements of fundamental movements that build into synergies, that build into activities of daily living. So if you are failing the basic fundamental movement blocks, then I have very little recourse other than to start with improving these fundamental blocks and not wasting my time trying to get you to do an activity that you are not going to be able to do well because the very basics of it are already dysfunctional.
Okay. So, you said a few things there that we can unpack a little bit, which is, number one, we of course take it for granted that there are such things as fundamental movement patterns.
Mm-hmm.
There are, of course, there are the people out there that don't necessarily believe there's a an ideal way to do something, or that there's many options, and
Well,
essentially, as long as you could do it smooth, as long as you can do it without pain, as long as you can accomplish the goal, then that is ultimately the test of whether or not something is fundamentally good for you. So when you're talking about, well, this person's ADL or something in their ADL has broken down. Something functional that they're doing is
mhm,
breaking them down, causing them to be in my office.
mhm,
We look at that and say, okay, well, that this particular thing that they're doing is a much more complex type of movement pattern. Whether you want to talk
mhm,
about it as a functional pattern, a pattern of ADL, it's a complex thing. And you and I,
mhm,
as DNS providers, try to break that down or qualify the pattern and say, well, this is ultimately a problem of turning, or this is ultimately a problem of locomotion.
mhm,
And that's based on certain types of patterns. And then we revert back to the fundamental patterns that this person is using. Like you said,
mhm,
crawling is a locomotion pattern that is obviously, in one sense, a bit easier than walking or running. So if somebody's having a problem with running, you, like you said, you can't just tell them we'll run better. You know,
mhm,
there is a problem with running, so we take it back to its most fundamental level of running, which can
mhm,
be on the ground in a
mhm,
crawling pattern or even less
mhm,
than. And if that
mhm,
patient can't even demonstrate that they can do that well, then they have obviously no business. At least this is an indication that, yeah, we can see why running is hurting you, you know.
That's
And
right.
that's
Yes.
why I would at least begin with them on the floor or in
Mhm,
that baby position. And of course,
mhm,
once we've established that as kind of the principle, now it's, if we determine that your problem that you're presenting to us with is at least partly about stabilizing your lumbar spine and being able to breathe, well, then we can just revert back to the developmental process and say, when is the first time that you learn to brace and breathe your and
mhm,
stabilize your low back? And then we
mhm.
ask them to do it. And if they can't do it, well, now we have to start training them. Of course, if they can do it, we just move them on.
That's right. That's right.
Okay. Okay. So yeah, I mean that ultimately, I think, like you said, I mean that is the idea of why we would roll somebody around on the ground or
That's right.
have them crawl, things like that.
Yeah.
But the important thing to just say is, the goal is not to keep them on the ground. The goal
No.
is not to keep you in this baby position. The goal is to be able to utilize that pattern that we're establishing and
Mhm.
utilize it and transfer it and integrate it into your functional movements and into your ADLs. That would be the
Yes,
idea, correct? Yep.
as quickly as possible. That's right. So the these assessments have to be done. They are not the goal in themselves, and that is important. It is. I am looking for information about the quality of movement, how you use support points, how you use muscle chains, and so on. And these qualities or these resources, that's what I'm interested in assessing. And it is good to have a standardized procedure by which to assess them. Otherwise, it is difficult to compare them from case to case or within the same case. So that if I have a series of fundamental movements that I know are basically set in a certain way, are constructed in a certain way, and we've seen this through the child development, I can use these fundamental movements as an assessment base. This takes the variability out of it, and it allows me to draw similar and comparable conclusions from one person to another or from one session to another. And that is the important thing.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.